1 second.
Right. Hello, everyone. I'd like to extend a huge welcome from the UW Green Bay Wellness Center. I'm Amy Henniges, and I'm the Director of Counseling and Student Support. And new this year, we have partnered with Prevea Health to bring you the health services in our Wellness Center, which also includes our usual UW Green Bay counseling. On the next slide, Adam. I just want to remind you all that our counseling services and medical services are still located on the main campus in the Student Services building in room 1400, just down from the bursar. We have the same phone number, 465-2380, and we have a brand new website at wellness.center, and our email is wellness@uwgb.edu. On the next slide, I just want to tell you a little bit more about our counseling services. We have a team of 4 licensed professional counselors ready to assist you on the Green Bay campus, and we're offering virtual counseling sessions to our students on the Marinette campus. And we also have contracted counseling available at both the Sheboygan campus and the Manitowoc campus. And our counselors are ready to provide one-on-one personal counseling for you or with you. And we also provide crisis intervention. And we do have 2 counselors on the main Green Bay campus that are also certified in alcohol and drug abuse. And please remember that the counseling services in the Wellness Center is the one place that students can come to report a sexual assault or a domestic violence situation and get support and help and still have their name remain anonymous to the campus. So we are a safe place to come and to assist you with that as well. We'll also have an MSW intern on our staff this next academic year, and we're looking to provide you many of the counseling sessions virtually. So please call ahead as you make those appointments, and we'll set it up either virtually or telephonically. And if we aren't able to help you directly, we will definitely help connect you with a resource in the community that can help you. The cost for counseling is totally free as part of the tuition you're already paying, and we're open year-round, Monday through Friday, from 8 to 4:30. And on the next slide, I just want to remind all students too that you'll soon be getting an invitation to complete a sexual violence prevention training, and Caitlin Hendrickson is also part of our team that works with us on sexual violence prevention, and we are very committed to having a safe campus and to preventing sexual violence on our campus, and all students will be asked to complete this training this fall semester before they register for classes in the spring. And next, we're going to have Michelle tell us about the medical services that are coming to us from Prevea, who's just joined our team. Thank you, Michelle. Michelle, you have to unmute.
All right, let's try that again.
Thank you.
Thanks for having me. As you said, my name is Michelle Cullen. I'm a nurse practitioner. I've been with Prevea for many years and now had the nice opportunity to be able to come out and work at the Health and Wellness Center, along with Katie Carlson, who will be talking in a minute or two, one of the nurses, Amy Depot, and then the other nurse practitioner, Sue Borneman, as well. So we are here for you to be able to try to offer answers to your health questions. Obviously, if you're feeling ill, if you need a wellness exam, a physical, contraception, any type of recommendations on that type of thing, you can come on in. We do have low cost medications here. We don't have everything, but we do have things for certain conditions that we can dispense for you, some immunizations as well. And we do have lab services also. And on the next slide, the exams that you come to the Wellness Center for here are free of charge. If there are any labs or diagnostic type things that need to be done as part of the visit, those do need to be paid for either through paying out of pocket with cash, HSA, debit, credit, or check, or they also can be billed to your insurance. So either one of those, but the actual office visit itself, again, is free of charge. The medical side of the Wellness Center is open Monday, Wednesday, Friday, 8 to 4, Tuesday, Thursday, 9:30 to 5:30, and Saturday hours, which I think is a new option for you this year, is the hours are 8 to noon. The center is open, again, medical aspect of it is open mid-August through mid-May, and then off during the summer, but otherwise we are here. So the next slide. There are other options that Prevea has for you to be able to get questions answered and get your health needs taken care of. One of the ways to help get questions answered, if for some reason the Wellness Center is not open at the time you need it, you can call Prevea after hours, and that will connect you to an experienced medical personnel, usually a registered nurse, and they can do their best to be able to give you recommendations or direct you on what to do for what might be going on. And again, that is something that is available though 24 hours a day. And the next slide. There is something called Prevea Virtual Care. This is also a completely free service. This is an actual computer-based visit per se. What you do is you sign on to prevea.com/virtual care, and it will prompt you to complete about a 15-minute survey of questions that will ask you about your condition or your problem and what's going on. It will then be sent to one of our urgent cares. Again, not the Health and Wellness Center, but this information will go to one of Prevea's urgent cares, and a provider at the urgent care will review it, and they will get back to you usually within about an hour, unless it's within an hour of closing of the urgent care. Then you might have to wait till the next morning. So certainly if it's an urgent condition, you wouldn't want to utilize this method. But if it's something that's not urgent and might be able to be taken care of and wait till the next morning, if necessary, you could do it on the Prevea Virtual Care. It's not a guarantee they'll be able to give you a diagnosis and treatment, but if so, they will do that for you. And on the next slide, we do have Prevea urgent care settings all around, the rural areas, certainly in Green Bay, that are available to you to be seen at. Now, those who live on the campus here, certainly you're asked to try to come to the Health and Wellness Center first. If it is something that might be a little bit more involved, we may have to ask you to go to an urgent care setting, but you still do have the opportunity to utilize any of Prevea's urgent cares. Now, that would be billed to your insurance though. For those who don't live on this campus but go to the off-branch campuses in Marinette, Manitowoc, and Sheboygan, because you don't have an on-site health and wellness center, because you're at the branch sites, you can actually utilize the urgent cares somewhat as your health center. If there were any lab or diagnostics though, same as at the wellness center here, they would need to be billed to insurance. So you can utilize the Health and Wellness Center webpage. There's a link on there, and it can further explain all of these services in more detail. So, but just know that we're here trying to be there in many realms as possible to get you the healthcare or the answers that you may have. And then the next slide, I think, is just reiterating again. On-campus students have access to the urgent cares. Again, that would be billed to insurance. Those branch campus students, you do have access to those urgent cares, but as a benefit, because you don't have access to the Health and Wellness Center, you can utilize those urgent cares for a lot of the same things that students on campus can use us for. So I know that's a lot of information. That's why, again, you can either call us or, again, utilize the website and the link to try to help sort through and answer those questions about what services. And then I think after this, we are probably on to Katie.
Yes, hello, my name is Katie. I'm one of the nurses in the Wellness Center. I'm just going to review with everybody just the symptoms of COVID-19 in addition to how you can go about getting tested if you're symptomatic, and how we are processing those here on campus. So Adam, if you want to do the next slide for me, please. So some of this is probably common knowledge for a lot of you students. However, we like to review it with everyone just for some more information. But a fever of 100 degrees or greater, chills, you'll cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, a sore throat or congestion or runny nose. Do keep in mind that you don't need to have every symptom that's on this list. You may have one, you may also have them all. But what we are recommending, that is, if you do have any symptoms and or you have a fever of 100 degrees or greater, that you get tested. And to do so, what you're going to want to do is to sign on to My Prevea, and you're going to fill out, essentially it's kind of, you'll work your way through the questionnaire in regards to your symptoms, and then it's going to ask you where you want to have your test completed. And do make sure that you click the UWGB, UWO Lakeland student staff COVID testing, like you see in that with the arrow pointing to that bottom box there. Then you'll want to select that you're going to be tested at UWGB. That automatically will send your order over for your COVID screening, which will be done on campus. It will be done, you'll want to come towards or outside of the health center or the wellness center. And we would ask that you call when you get there, not to come into the office. And your testing is actually going to be done there's 2 rooms that are set aside, not in the actual wellness center for the testing. The testing goes, some of you may be familiar, but if not, it's a nasal swab. After we collect the nasal swab, you will be asked, those that are symptomatic, that you'll relocate to isolation housing until your test results come back. And if you have, any other questions, we'll help you to find the right resource for your answers. And Amy will talk about here in just a second regarding what they'll do next. And I think that might be it for me, Amy.
Okay, well, let me tell you next about our COVID response team. First of all, just to reiterate, if you are ever having symptoms, we do want you to stay home, stay in your res hall if you live on campus. Like Katie said, log into My Prevea, do the screening, get tested. If you have questions any time of the day or night, you can call that 24/7 after hours number at Prevea, or you can also call our COVID response team, and our phone number is listed here. It's 465-5060, and our email is covidresponse@uwgb.edu. So we're already busy answering student questions since the move-in day. And again, if you live in residence life, we're going to be asking you to move to the isolation housing, and we will help make arrangements that your dining could be delivered right to the isolation housing where you're at. Our COVID response team will be just helping to advocate for you. We'll be working with Brown County Public Health to do what we call contact tracing, to try to identify who are the direct contacts with you, so we can help educate them and be in touch with them and help keep our campus safe and keep you safe. And we'll also help with things like notifying your faculty that you're needing to be out of in-person classes, for example, if you're in isolation until your period of isolation is done. So we're here to help you. There's really no, if you have any questions, give us a call. I know one of the questions, Katie talked about the symptomatic testing that's done with Prevea, but also Res Life students, people living on Res Life, are going to be asked to do antigen testing. You just got a letter from Gail a short time ago, and when you go into that same spot where you get to the UWGB student section, you want to pick, do the screening. You are asymptomatic, so you want to pick the reason for your testing is surveillance, and that will get you signed up for the surveillance testing that's actually also happening over at the Crest. So that's not if you're sick, like Katie was describing, but that's our surveillance testing. So we're already starting to get some questions about that. So next we'll have Gail share a little bit more about our campus expectations. Thank you, Gail.
Hi, everybody. My name is Gail Sims-Albert. I'm happy to serve as your interim Vice Chancellor for Student Affairs and Campus Climate. And as Amy said, I'm here to share just some general information about campus expectations in relation to COVID-19. On this slide, you'll see what I assume at this point has become common knowledge for everybody, but we are asking that while on campus that you do your best to maintain a physical distance from other individuals of at least 6 feet, understanding that in some cases that may not be obtainable, but you will find that our classrooms have been adjusted to allow for this, as has dining and other popular venues across campus. Of course, we want to at all times refrain from touching our eyes and our nose and our mouth in case we have picked up germs along the way. We do not want to transfer those things to those sensitive areas. And of course, you will be asked to appropriately wear a face covering while on campus. That does not include our outdoor spaces, but if you do find that you are traveling across campus with another individual, if you are not able to keep that physical distance, we would ask that you keep a mask on to help protect one another. One of the other things I think you'll notice across campus is that there will be cleaning products or disinfectant wipes that are made available to you. And we ask that you utilize those before you begin to utilize a space and after you're done using a space to ensure that it's clean for you and to help ensure that it's clean for the next person. This is not just in the classroom, but if you're one of our residential students and you decide to use one of our lounge or kitchen spaces, you'll see that cleaning product has been made available to you, and we ask that you use it appropriately at those times. Adam, if you want to advance the slide. In the same token, we all know that we need to wash our hands and we need to wash them frequently for at least 20 seconds. And if we're unable to do that, of course, we want to make sure that we're using hand sanitizer in its place. Also, another good suggestion is that we want to cover our coughs and our sneezes with a tissue when at all possible, definitely at a minimum with the crook of our elbow, but to use a tissue and then to appropriately dispose of it in the trash and then immediately wash or disinfect our hands would be best practice right now. And then of course, as we've all been told, if we are ill, if we display any of the symptoms, that we need to stay at home. Our faculty are in a good place to understand that our health and our wellness come first, and that we need to take care of ourselves, and that the schoolwork will wait. But one of the awesome things about learning in a virtual modality is that even if we may not feel 100% healthy, we're still able to study from our place of residency. And so know that your academic accommodations will be made available to you wherever you so choose to study from. And Adam, if you want to advance it again. And just some last points to ponder, if you will. We have announced and marketed that we do want our students to complete a daily self-assessment, and that self-assessment is located in the EAB Navigate app that I hope you've all taken the time to load onto your personal device. If you have not done that or have chosen not to do that, the self-assessment can also be found on the Phoenix Forward website page under the student tab. We are asking all students who have a need to be physically present on campus complete that tool before traveling to campus. And so our residential students, they will need to fill it out daily before they head out for class or to have breakfast or whatever the case may be. And our commuter students who have a need to come in for a class or an appointment in an office or any other university transaction, we ask that you complete that assessment tool before you depart and come to campus. We've also asked that all of our students take a training which is comprised of watching a video that's been produced by UW System, that you watch a video and you sign a pledge. Both of these things also can be found on the Phoenix Forward page, and the pledge is a basic statement saying that you will commit to following the 3 W's and do your best to keep yourself and your fellow students and faculty and staff safe while you're on the campus. And so that is a voluntary commitment, but we ask that all students make sure that they, at a minimum, watch the training. One of the things that will change for this fall is that we are asking you to refrain from just dropping in at different offices, hoping that you can catch a staff member in. A couple of different reasons for this is that many of our staff will continue to work remotely throughout the fall, and so the staff member that you're looking for may not be present in the office when you come in. And of course, we are looking to mitigate the spread of the virus on campus and therefore de-densify the number of people who physically come to an office on campus. And so our staff would be very much willing to set up any meeting that you would like to have in Microsoft Teams, Zoom, or a similar technology for you. You'll notice across campus when you come for classes and for other reasons that our facility staff is going to be busy cleaning pretty much all of the time. If you come across a staff member who is cleaning the space that you intend to utilize, if you can just give them a moment, allow them to disinfect the area, then you'll have access to that. So we ask that you allow them to do the job that they've been asked to perform several times a day. And you may even see for residential students, you'll probably see non-facility staff out cleaning those high-touch areas throughout the day and throughout the weekend. So give them a moment to take care of business, and then you'll have access to that area again. Floor markers, I'm sure that everybody's become accustomed to the idea of seeing floor markers in different places of business. The university is no different. We ask that you be respectful of the markers and adhere to their placement so that we can keep one another safe. In the same token, we ask that you honor the 6 feet of physical distancing between everybody, no matter the activity. So again, even in dining where quarters tend to be tight, or in small office spaces, we ask that you do your best to keep that 6 feet of distance between yourself and all others. And also, we ask that if you intend to gather, that you do so safely, that we keep our groups in for activities and events and meetings, that we keep them to less than 10. And for anybody who is a residential student, we ask that you also be respectful of our new visitation policy, knowing that if you live in a residence hall, no more than 1 guest per time can be hosted in that space for up to 3 hours, and no overnight guests are allowed. And if you reside in an apartment, apartments can host 2 guests maximum at any given time, again for up to 3 hours, and no overnight guests. Keep in mind that when you do gather in these groups, it's still best practice to socially distance that 6 feet and to wear a mask at all times. So with that, I will turn it back over to Amy, but I wanted to say thank you for all you're doing as our students to keep yourself and one another safe as we head into the fall semester. It's truly appreciated.
Okay, thank you, Gail. At this point, we would like to open it up to any questions from our students. If you want to add them, please, to the chat room. We will do our best to answer your questions.
Yes, so on your screen, there are speech bubbles, should be in the top right. One has a question mark. If you click on that, that is where you can submit your question. There was one question that we have been asked, and that's, if we have to get tested every other week, do we have to stay in isolation until we receive the results?
Well, I'll jump in. I would say for the biweekly antigen testing, that is for all those who are asymptomatic. And for that reason, no one would need to isolate between the time that the sample is taken and the results are known.
And our plan is, if you do get a positive antigen test, you're going to be referred to the wellness center and will likely need to do another level of test, a molecular test called a PCR test.
There was a question of where do you put your results for our daily inspection? Or maybe this is the continual bi-weekly.
So are you referring to the screening tool that the students are filling out? Is that what the question is, Adam?
Oh, that could be. So yeah, I was just asking, where do you put your results for our daily inspection? So yes, that may be the screening.
Yes, so if you'll go in and complete the daily screening, anytime you answer yes that you're symptomatic or that you've potentially been exposed to somebody or you're suspicious you've been exposed, it will trigger an email to our COVID response team that will be back in touch with you for additional clarification and to discuss your situation and to advise you on next steps. If you are symptomatic, however, when you fill out that questionnaire, it will link you back into our resource to start that myprevea.com process so we can get you tested as soon as possible. Great question. Any other questions? Okay, looks like there aren't any more questions coming through at this time, but please know that you can call or email us at any time, and all of us in the Wellness Center team and on the COVID response team are happy to assist you and support you, and we wish you a happy and healthy and safe semester here. So please let us know how we can help if you need help, and have a great day. Thank you.